I'd now like to call up the Cannabis Marijuana panel. As they're coming up, I'm going to introduce them. First panelist is Justin Stern. He's a member of the Duane Morris Trial Practice Group, as well as runs the Cannabis Industry Group. He is a summa cum laude grad of University of Miami Law School, so obviously he's a very bright human being. Go Canes. Dr. Fernando Senda, 35 years practicing as a board-certified internal medicine doctor and cardiologist. He is the founder of LifeCann MD. Signs right over there. It's a medical marijuana practice for the evaluation and education of patients afflicted with conditions that are affected and can be treated with cannabis. Jon Barack is the founder of Jushi, which sounds like sushi. They are a multi-state operator, a multi-state owner and operator of cannabis licenses. He has spent over 10 years in the hedge fund space and is the founder and corporate secretary and head of business development for Jushi. And finally, we have Kirsten Yeager from Green Treets, which is a CBD driven organization based, I think their first operation was in South Miami. They're affiliated with a group out of Colorado who is producing and selling cannabis. And she has been involved in the creation and of a whole new product line of edibles and ointments of hemp-based and cannabis-based products. All right, and I get to play moderator. I'm not going to ask how many of you have been or are recreational users because no one's going to answer that. So the first question I'd like to throw out for the panel is, what's the difference between hemp and cannabis? Doctor?
Well, first of all, I will say that I'm really disappointed because I was going to buy property in Hialeah thinking that it was going to be off waterfront because of the climate change, and the previous panelists, they disencouraged me of buying it.
You just have to wait long enough.
Okay. Now, hemp and marijuana, they all come from the cannabis plant. The difference has to do with the amount of THC in one versus the other. If you have less than 0.3 THC, it will qualify as hemp CBD. If you have more than 0.3 up to whatever, then it's called, it will be medical marijuana. THC is the psychoactive component, is what makes you high. CBD is the anti-inflammatory. It doesn't have any psychoactive component. That's why CBD now is legal if it has less than 0.3 THC, whereas medical marijuana, you need a medical marijuana card.
All right. Now, Justin, from the legal perspective, what's the difference?
The difference is that...
I'm throwing this to Justin.
So from the legal perspective, the difference is that hemp is now legal. So hemp was legalized by the passage of the 2018 Farm Bill in December of 2018. So assuming that hemp is produced in accordance with the approved state plan, it is legal. It's treated like an agricultural commodity, like a bale of hay. So there's a big difference between the treatment of hemp and marijuana at the federal level. Now, there are still a bunch of regulatory issues that are being worked out. Under the FDA's guidance, CBD cannot be ingested. It can't be put in dietary supplements or food. But we're expecting some movement on that in the not-so-distant future.
Okay. Jon, when you're looking at different states on doing cannabis or hemp activities, what are your markers? What are you looking at? And what do you project? Where do you see the markets going in both sides?
Sure. So they're very different markets due to the conflict of laws at the federal level for cannabis sales and production versus hemp. In addition, at the state level, you have regulatory moats that are created for cannabis in particular, and state-granted licensing, which is highly regulated depending on the state, if it's allowed at all, which creates kind of like mini markets. Each state is almost like a new country, and you need to develop a state-level business plan accordingly, whereas hemp markets don't have quite the same level of regulation, and those moats largely don't exist with some potential exceptions in like a New York and also possibly in Florida, where they're trying to potentially create state, basically gates to prevent out-of-state production being transported into the state. New York has, I think, created those laws and regulations, but hasn't put them into effect yet. But for that, you can potentially cross state lines with hemp or hemp-derived CBD. FDA regulations aside, that will ultimately lower prices across the market and across the country and create, nationwide markets and supply chains which don't exist for cannabis and are currently, precluded due to the conflict of laws scenario. And so it's a very different business model for, entry into a cannabis market at the state level versus the hemp CBD markets.
From a practical standpoint, Kirsten, hemp in Florida, cannabis in Colorado, how do you protect each of the different silos so you don't get in trouble?
Well, in Colorado, we make sure we follow all of the guidelines, and obviously there isn't any, like Jon had said, you can't sell outside of the state, and that's why we decided to go into the CBD market, where now we're selling it in Colorado and Florida. And so it's just basically making sure that you're aware of all the regulations and following them, documenting everything.
Okay. Justin, when did hemp become legal and how?
So it was legalized in the 2018 Farm Bill. And just to piggyback on what was recently said, one of the key points in the 2018 Farm Bill and in the draft rules that just came out a couple of weeks ago is that Congress said that states cannot prohibit or inhibit the interstate transportation of hemp. So that's just another big example of how different the treatment is at the federal level. Obviously, you can't bring across state lines a Schedule I controlled substance, which marijuana still is, but hemp now is definitively not. It is not a controlled substance, and not only are you allowed under federal law to bring it between states, states can't stop you from doing it.
All right. And doctor, how do they determine the levels of CBD versus THC? And is it harvesting? Is it testing? How is it discovered?
It's basically testing. There is when you go to buy hemp, you should have a quality control, and they should tell you exactly how much THC, how much CBD, and other components like terpenoids, which are also added to the hemp and to the cannabis for other benefits.
Mm-hmm. So, and this is for the whole panel. Following up on that, how do you know what they put on the bottles or on the wrappers is accurate? Is there an industry standard? Is there a testing group?
Well, you're supposed to have a QR code on the products that goes right to a website that has the certificate of analysis, where Florida is requiring that not only the cannabinoid profile, but also you don't have to test the terpenes, but you have to test for heavy metals, pesticides, microbial content. And so you should be able to just scan it with your phone if you see a product, and it should take you right to those test results. So, definitely that's something, it hasn't, the regulations haven't gone into effect. However, they should be in effect soon, and you should really be able to see those certificate of analysis even today.
So there are two different, there's a difference between making sure that the label says what the label's supposed to say, and then making sure that what's inside the bottle is reflected on the label. So to the first point, every state that has a hemp program essentially has their own list of label requirements, and they're very burdensome. And there is a lot of crossover, but what you see some companies starting to do is just say, okay, let's make sure that we're complying with every state that we possibly can. And so you're putting all of this text onto the labels. Now, we've also started to see recently some lawsuits starting to pop up across the country where people have taken what they thought were no THC CBD. That means just the CBD that's derived from hemp, but that doesn't have THC in it, and then taking a drug test and thinking, oh, well, I took a 0 THC CBD. Why am I, testing positive for marijuana? So that just goes to emphasize the importance of actually making sure that the testing is done properly and that you have the certificate of analysis, because this is serious stuff.
All right. And Jon, what markets, what states are you focusing on now and why?
So we approach the markets opportunistically based on, I think we're founded by ex-hedge fund guys, and so we are concerned about, in our capital allocation, where we think we'll have sustainable excess margins across the supply chain. And so our first markets that we've bought assets include Pennsylvania, where we bought into a chain of dispensaries called Beyond Hello. They have 5 dispensaries that are open today. We're on the way to going to 15 dispensaries, which is the state cap for any single operator. Pennsylvania is a medical-only market, and the licenses are capped, so that creates market conditions which are in some ways similar to Florida, which is a medical market with so far limited licenses. It's not vertical in Pennsylvania, but still it's limited licenses. We also have stores that we're in the process of opening in California, which is the largest adult use market in the country, obviously. There are no state-level caps, but there are municipal caps for retail in particular, so we're focused on high-value retail locations there. Another state-level market which we found quite interesting is Virginia, which is a brand new medical program. We have a majority position, 1 of 5 operators there, so it's sort of like Florida was in its medical cannabis program a couple years ago, when there were only 5 operators and 5 licenses. Except in Virginia, unlike Florida, there is no mechanism to increase the number of licenses, so it's 5 vertical licenses. The state is divided up into 5 quadrants. We have the quadrant that is closest to DC, so 2.5 million people who can shop at our 1 store. So that's definitely an interesting market. And then we're in a couple other states, Ohio, Illinois, and applying in a variety of states. And so, again, it's our approach to markets is de novo analysis of each market, because they're all completely separate, as I said before, due to the federal illegality. And so we do a fulsome analysis of each market and the supply chain in each market in order to determine the best use of our capital.
All right. And I'll throw this out to the panel on banking complications, hemp versus marijuana and the cannabis side of it. What can you do, what can't you do, and what are you allowed to do?
Yeah.
I'm sure you're familiar, unfortunately.
Yeah. I'll give a brief overview. It's I haven't found hemp to be easier to deal with than cannabis. Interestingly enough, we have a hemp processing CBD license in New York, and we've siloed that business from our cannabis business, thinking that we'd have the ability to finance it in a sort of easier fashion than the cannabis business, but we face some of the same difficulties as cannabis, which typically requires a state-chartered bank or a credit union at most to provide banking services. In some states, there's virtually no providers. In other states, there are a handful. For our hemp business, we've not found any significant source of liquid financing, despite our thought that the federal legality of the end product would make it just an easier, we thought that business plan would be more easily financed, and it turns out it really hasn't been. We went out to, I think, 100 different lenders just to see for equipment financing whether or not we'd be able to get, rates that are materially better than the cannabis rates we see out there, and we haven't, which was somewhat surprising. So.
Sure. No, I mean, that's all very familiar. Obviously, banks that are chartered nationally have to contend with federal law and federal regulations, and as I mentioned, marijuana is a Schedule I drug, and hemp was just recently removed from the controlled substances list. So there will be change. I would imagine that hemp banking will show up much sooner than marijuana banking, but even now, for financial institutions that want to deal with marijuana-related businesses, which is what they're called, there are ways to kind of comply, although you can never be fully compliant. So the DOJ has kind of an unwritten policy now of not going after banks that are doing business with compliant marijuana-related businesses or the marijuana businesses themselves. The Financial Crimes Enforcement Network has developed a series of reports that banks are supposed to issue and file with the government if they're doing business with marijuana banks. So there are financial institutions that are in the business, but as Jon mentioned, it's pretty hard to find.
Yeah, I would like to add that marijuana is a Schedule I, which means that it has no medical benefit and is highly addictive, and we know that's not the case because it helps a lot of patients, and there is no addiction from it. However, the patent for CBD is owned by the American government, and when they applied for the patent, they stated that it has a lot of medical benefits. Number two, the synthetic marijuana, like Marinol, which is given to people with cancer to increase their appetite, is a Schedule III. So does it make sense? Synthetic marijuana is a Schedule III, and the marijuana from the plant is a Schedule I. It makes no sense.
Now, to kind of explain it in English to us, the typical patient you see is whom?
I was speaking in English, by the way, so.
I know, but I'm a real estate broker.
Okay. The patient that we see, there are 12 different conditions that come to the doctor to be treated. Cancer, epilepsy, there are 12 different conditions that can come to the doctor to be treated. I will say that probably the number one patient that we treat was a patient with chronic pain. Up until 2 weeks ago, the Department of Health of Florida sent us a letter stating that chronic pain should not qualify for treatment for medical marijuana unless it's associated with the other 11 conditions. Obviously, whoever made the law doesn't understand that when you have glaucoma, you don't have pain. So it's like, this is the medication that will allow us to break through the opioid crisis. And unfortunately, nobody's seeing it that way.
And Kirsten, who in the hemp store, the CBD store, who's the likely consumer that you can service?
Pretty much the same as the doctor was saying. People, when they come to the store, they either have sleep issues, they have a hard time sleeping, or pain are the two people that come through the store. But obviously, anybody who just wants to experience better health would benefit as well. But oftentimes, we see them once they have an issue that they want to address.
I thank you very much, and this wraps up the panel. You'll be available later for questions and answers.